One of the most important issues facing family caregivers of adults with IDD is Medicaid and optional Medicaid services. Our state is faced with a budget deficit again, and we hear budget analysts and department or division staff give reports to our legislators on the Medicaid budget. It is rare that IDD is presented at all. It surprises us that the government staff think that Medicaid is complicated and that they repeatedly tell the legislators that it is complicated. We don't think it is complicated at all. It simply is a federal entitlement program that states apply for through a state plan. Within that state plan, there are mandatory services along with a range of optional services the state may choose to include. There are also optional services that a state can apply for using waivers. The applications are really nothing more than a check-the-box yes or no form. And truly, the bottom line is that Medicaid, either through a state plan or a waiver, is for poor people. As the federal Medicaid law currently stands, most of the long-term services and supports for both children and adults with IDD that Medicaid provides are either waiver services or ICFMR facility care, and those are both optional. ICF stands for Intermediate Care Facility, and MR stands for mental retardation. ICFMR facility care may be state-run centers or state-run community homes, and they may even be privately run centers or privately run community homes, all paid for with taxpayer dollars. A facility that is an ICF, that is, Intermediate Care Facility, is a nursing home and is a mandatory state plan service. Unfortunately, it is not very common for a person diagnosed with IDD to require a nursing level of care. Therefore, people with IDD are not provided with any level of mandatory long-term care through Medicaid. It seems unbelievable to us that people with IDD are considered optional in the United States of America. We understand that this discrepancy should be addressed at the federal level, but to listen to staff repeatedly refer to ICFMR care or waivers as optional and as services that the legislators could eliminate is just plain mind-boggling. It seems unbelievable not to hear our legislators question the staff on how the people with IDD would be impacted by the elimination of the optional and/or waiver services. We are family caregivers of adults with IDD who want our legislators to tell us that they know we are not optional. And despite the fact that the federal law has not been changed, they will preserve our long-term care services through both ICFMR facility-based care and waivers.